What's up, all my purple bears out there? Welcome back to Purple Bear Biology. In this episode, we're going to continue our exploration of anatomy and physiology, more specifically on the topic of our cardiovascular system. We're going to talk all about the heart today and discuss the general morphology that can be found on the outside and the inside of our heart. Comprehensively, the cardiovascular system is an intricate network of arteries taking oxygenated blood out to the tissues and veins bringing the blood back to the heart so that it can be reoxygenated into the lungs. Observing our cardiovascular system in such a comprehensive way can be quite overwhelming. So what we're going to do is focus in on pieces, starting at the pump and working our way outward, looking at the vessels that actually transfer the blood to the tissues. First, let's put a skeletal system over this cardiovascular system so we can see where the heart actually sits inside of our thoracic cavity. Notice that the heart is actually a little left of the mid-sagittal plane. If I remove the skeletal system and all of those peripheral arteries and veins, notice that the heart tissue itself is not visible because it's wrapped up in protective membranes called pericardial membranes. There are actually two pericardial membranes, the parietal pericardium that can be seen in green and the visceral pericardium that is touching the heart's surface. In between those two membranes, you can find a fluid called serous fluid that serves as a lubricant to prevent frictional heat from building up and damage occurring to the heart. If we leave this parietal pericardial membrane and remove it, you can see the visceral pericardial membrane that comes in contact with the heart tissue underneath. If we remove this membrane, we can then see heart tissue as well as fat that is deposited around the heart's exterior. Okay, cool. So now let's get down to the heart structure itself. Your heart has 4 chambers, 2 atria and 2 ventricles. The atria occur on the superior side of the heart, while the ventricles occur on the inferior side of the heart. Attached to the atria are structures called auricles. Auricles are like expansion units for your atria so that they can hold more blood. You have a left and right auricle. The right ventricle is on the most anterior portion of the heart, while the left ventricle is found more on the posterior side of the heart. If I pause the animation, we can also see a primary sulcus that goes down the center between the 2 ventricles. This is called the anterior interventricular sulcus. Additionally, along the margin separating the right atrium from the right ventricle, we have the atrioventricular sulcus. Another atrioventricular sulcus exists on the left side of the heart as well, separating the left atrium from the left ventricle. If we shift to the posterior side of the heart, we can actually see that there's a posterior intraventricular sulcus as well. All of these will be more important when we talk about coronary arteries and cardiac veins. So shifting back to the anterior side of the heart, let's start taking a look at the internal morphology of these chambers. Starting with the right atrium, I'll select the auricle and remove the rest of the heart. Spinning around to the anterior side, we can see the muscle that lies underneath. The muscle found inside of the right and left atria is called pectinate muscle. If we add the rest of the heart back, but leave off the anterior portion of the right ventricle wall, we can see into the right ventricle. Looking down into the right ventricle, we can see a valve that leads from the right atrium into the right ventricle. This valve serves to regulate blood flow between the 2 chambers. This is the tricuspid valve. It's called tricuspid because it has 3 flaps. Attached to the tricuspid valve, you can see tiny strands commonly called the heartstring. The scientific term is chordae tendineae. If we follow the chordae tendineae down, we actually come to muscle that it's attached to. This muscle is called papillary muscle. You may have noticed something else over here attached to the ventricular wall. This structure is called the moderator band. The function of the moderator band is to prevent the right ventricle from taking on too much blood. Because the amount of stretch that a heart encounters is related to how hard that it pushes blood out, too much stretch in this ventricle could lead to too much pressure in the pulmonary circuit that leads out to your lungs. If I rotate a little bit, you can actually see that there's another valve leaving the right ventricle. This valve is called the pulmonary semilunar valve and leads up through a structure called the pulmonary trunk. Now let's take a look inside of our left ventricle. First thing that I want you to notice is that the left ventricle actually has really thick muscle tissue around it. The reason for this is that the left ventricle is responsible for pumping blood to the entire body. If we take a closer look inside, we can actually see similar structures to what we saw inside of the right ventricle. There's a valve called the bicuspid valve, also sometimes called the mitral valve. The bicuspid valve has two flaps. Additionally, if we look, there's also chordae tendineae attached to papillary muscles, and another really cool angle of muscle tissue in the inside wall of this is called trabeculae carneae. This was also inside of the other ventricle. It's just easy to see here. If I rotate the heart a little bit, you can actually look into the right ventricle and see that there's another valve. This is called the aortic semilunar valve, and it leads into the aorta. Okay, so now that we know that there are four chambers of our heart, atria and ventricles, keep in mind that blood will always flow to the heart into atria, then enter from the atria into ventricles, and then flow from ventricles out to either the body or the lungs. To make this a little easier to understand, let's go back to the heart and follow blood as it travels through. First, blood is going to flow from the bottom part of our body through a vascular structure called the inferior vena cava. Blood from the top part of our body will come towards the heart from the superior vena cava. Both of these structures will dump into the right atrium. The right atrium then pumps blood through the tricuspid valve into the right ventricle. The right ventricle, receiving blood through the tricuspid valve, then pumps blood away from the heart through the pulmonary semilunar valve towards the lungs. Blood will flow through what is called the pulmonary trunk and out to the pulmonary arteries. Returning blood comes back through pulmonary veins and dumps into the left atrium. The left atrium then ejects its blood into the left ventricle through the mitral valve. Blood in the left ventricle is then ejected through the aortic semilunar valve and travels through the aorta to get to the rest of the body. If we remove some of the aorta, you can see the aortic semilunar valve here. Okay, cool. So try to master these structures from this video. In our next video, what we're going to do is talk about the vascular structures that are attached, as well as the coronary arteries and veins that help us circulate blood to and from our heart tissue itself. If you have any questions, drop them down in the comment section below. If you found the video useful, be sure to like, subscribe, and share it. As always, thank you all for watching, and see y'all next time.